Uncommon Transformation television series.
Health, they say, is wealth, and a healthy population contributes largely to an exceedingly productive society. This forms the basis for the prominence in which society gives to health. Surprisingly, in spite of its importance, the sector has continued to receive lip service, as it were, particularly in the third world, with mortality reaching an all-time high, raising questions as to the sincerity of managers of the sector, particularly when viewed against the backdrop of huge financial and material support from international aid agencies. The situation had been so bad that the citizens had no option than to seek solace from private operators when it became apparent that the public health institutions were failing. Prior to 2007, in Akwa Ibom State, the health sector was facing inadequate manpower, outdated equipment, dilapidated structures, inadequate drug supply and consumables, dearth of medical specialists, inadequate energy supply, high level of infant mortality, poor maternal welfare, poor salary and remuneration of health workforce, among other things.
You're watching the Uncommon Transformation television series. We'll be right back.
On assumption of office in 2007, the Governor Godswill Akpabio administration embarked on a holistic repositioning of the sector. Huge sums of money was injected into the system, coupled with the engagement of qualified manpower to run the sector.
I'm now a very happy man. I don't read and hear about pregnant women dying again in the home of bed attendants. And one of the things I did to stop women from dying in all these fake churches was to declare free medical treatment for all pregnant women in the state. And I spent millions, hundreds of millions of naira to supply drugs so that every single woman in this state, whether you are for Akwa Ibom or not for Akwa Ibom, so long as you are delivering here, it is free in the hospital and free with drugs. And then to ensure that those children receive vaccination, children from the 1 to the age of 5 receive free medical treatment in all the hospitals in Akwa Ibom. So, and then we had to increase the number of hospitals whilst building a specialist hospital here at the time.
Poliomellitis is an avoidable disease that could have been taken care of by proper vaccination and immunization. So I tasked the Minister of Health and I said, this must stop. So I can report to UNICEF and the International Child Project Group that in the last 2 years, at least from 2009, we have not recorded one single incident of COVID. And I want to make sure that we sustain this, because if we sustain it between now and what we are saying in 2015, we can, with collaborative efforts, totally eliminate polio, so that we don't need for wheelchairs for our children and violence.
To attract the doctors and possibly lure them away from private practice, which had become the order of the day, Akpabio dangled mouth-watering carrots, including increased remuneration, better condition of service, in addition to brand new cars for them. Available records show that doctors in Akwa Ibom State are among, if not the highest paid in the entire country.
We met a health system that was there in name, a situation where the doctors were on strike precisely when we came on board with the present administration of Obon Chief Godswill Akpabio, and he was disturbed. That was the first thing, because he knew that without health, all other sectors of the economy will become a serious failure, and that was the perspective upon which he started. We had to invite the doctors and have discussions with them to know what was their problem. They told us all what was very visible, and His Excellency, being a participant in the last administration, knew as much as they said, and myself too, having worked within the system, I knew that what was being said was exactly the gap that was required to be filled. To do this perfectly, we had to allocate 10% of the state budget to health, which was the international standard required. And I want to thank His Excellency for having accepted that. It's a difficult thing to do. It was a deviation from the past, where lip service was being paid to that WHO recommendation and UN standard. So with that agreement, we had to drop the strategic plan 3 phase that spanned through the period, and we started with the recruitment. I met a situation on ground as the hospital administrator and permanent secretary. I met a situation where we had less than about 100 doctors, less than that on ground, and to satisfy or cover up work for about 4 million people, 50 hospitals with about less than 100 doctors, it was quite unacceptable, and such a standard was quite not acceptable to this administration, talk less of global aspirational standards. Again, there was a situation where we met only one consultant on board in the entire service, which was the hopeless situation, which nobody looked at. We made a situation that since the creation of state, there was no recruitment into the health sector. There was a situation where even the nurses on ground will not be able to meet the next generation. I can assure you that the nurses we met on ground was quite insufficient. The normal WHO standard ratio 1:4, a nurse to 4 patients. The situation we met was a nurse to 20 patients, and you know, it was as bad as the case of the consultants and the insufficiency with the medical offices. We had to look at that sector, and the governor decided to look at our memo in terms of recruitment of medical officers. We had to bring them on board immediately. We recruited additional 160 doctors to the about 100 we met on ground, at least to give us a good picture in the country anyway. Gave doctors incentives. We are the highest paid medical doctors in Nigeria. Not because we wanted to show, but because we wanted the best. As I'm telling you, we have pediatricians, we have those fertility experts, we have all sort of consultants that are relevant to our situations. On very good salary, we gave them cars all over. The consultants are a higher grade of car, the medical officer according to your grades. It was something, was an innovation which other states are now practicing.
Having recruited the requisite manpower to man the scores of health facilities, the government embarked on the construction of 5 new general hospitals sited in local government areas where there were none. These were built at Ibono, Eastern Obolo, Okanafun, Esianudum, as well as Ika. All these have been completed, commissioned and put to use. The state is currently constructing a specialist hospital built to commemorate the 20th anniversary of creation of the state, in addition to other health institutions which have undergone massive rehabilitation. These include Equita General Hospital Oron, Emmanuel Hospital Eket, and General Hospital Ikorekwen, among others. Others include donation of 50 million naira to the University of Uyo Teaching Hospital for construction of a pediatrics block, construction of a renal dialysis center, and donation of 17 dialysis machines to the teaching hospital, procurement and commissioning of state-of-the-art ambulances, commissioning and distribution of health equipment, establishment of 8 anti-retroviral therapy centers, 15 PMT-CT centers, and 37 centers for free HIV care and treatment. Others also include procurement of 159 brand new utility vehicles for doctors in the state-owned hospitals, building of an oxygen plant at General Hospital Ikwerepene at a cost of 250 million naira. The list is endless.
There have been a kind of holistic renovation of this hospital. When I say holistic renovation, I mean structural renovation, manpower development, equipment, and so many health programs have come to be. Records available to me have made me understand that General Hospital Ikwerepene was built by the colonial administration in 1904. It's one of the oldest hospitals in the state, and over the years it has undergone a whole lot of changes to what you've seen now.
When we talk in terms of institutional strengthening, we're looking at the software and the hardware components. The hardware is the structure of the hospital itself. The software, equipment, and probably the manpower, the workforce. We saw that equipment were not there. Even if we had with the workforce, the hospitals were so dilapidated that we had to do some institutional strengthening by trying to rebuild, renovation, and etc. We did that. And in that process, a lot more hospitals came back, and we added 5 new ones to local governments that did not have any at all. There were 5. Kanafun 1, Ebena 1, and Sidubium with the 5 local governments. These are the ones that have been serviced now, so that in each of the 31 local governments we have secondary health institutions. So now we have 50 under institutional strengthening. So you can imagine what attention was drawn in within the first 18 months.
Most of the hospitals have been renovated, and particularly the hospital Ikwerepene and that of Eket and Kitaron have indeed enjoyed the overall holistic reform, upgrading of the hospital to standardize its activities and functions. For instance, now the hospital Ikwerepene we should start the training of house officers. So that is another uncommon transformation.
Okay, the laboratory in the General Hospital Ikwerepene before was nothing to write home about. In fact, we didn't have equipment, we didn't have machines to work on. The courtesy of His Excellency Chief Dr. Godswill Akpabio, you can see that even when you get into General Hospital Ikwerepene, you know that it's a renovated hospital and it's a prime hospital in the whole state. It's #1 hospital in the state. And the laboratory is running a lot of composite tests for all the patients of the teeming population that come to the hospital. We are running a 3-phase program for age from 0-1 to 5 years for the children, it's free medical, or for all the pregnant women, it's free medical, and from 65 and above, it's free medical. Don't charge a kobo. We are running all the 6 different types of tests for the hematology, for the clinical chemistry, for the urinalysis, for the bacteriology, for the culture, general collection, and the ARV patient, that is all the patients with HIV infections.
This is Akwa Ibom, the land of uncommon transformation.
With the aforementioned put in place, the state was indirectly laying a solid foundation for the take-off of the new health policy, which seeks to ensure that the citizens gained unhindered access to healthcare facilities in the most cost-effective manner, while the free healthcare policy for pregnant women, children under age 5, and the elderly is a venture which has received universal acclaim since its inception.
And we cannot forget to mention the free medical services to the aged, to the pregnant women, and to the children below 5 years. This is a very expensive program, but essentially in its usual characteristics and love for mankind has generously approved that has to start since 2007. So, as a commissioner, I've added value to that program by inaugurating a task force to make sure that that program is driven properly and is successful.
I want to welcome you to Manuel General Hospital, Ekpet. I also want to thank our amiable governor, Dr. Godswill Akpabio, for this wonderful program. In fact, we are very grateful that he has extended the uncommon transformation of his administration to the health sector through the free healthcare program. Talking about the situation of the free health program in this hospital, I want to say that it has been going on very, very well. The attendees have increased tremendously. It has brought a large number of patronage of patients to this hospital. We have large stock of drug, just like I've shown you around. The patients are getting it free of charge.
A very good program that our digital governor, Chief Dr. Godswill Akpabio, has taken. You want to realize that our aged people that had no money, some of them die quite untimely because they don't have money to come for the treatment. But since the inception of this free medical treatment, there has been a very great, tremendous change. They have been treated. A lot of them come were even in a hopeless situation, but before they leave the hospital, they will be smiling home.
The free healthcare of the government is being embraced by even our people and beyond very, very well. Since it was implemented that the aged from 70 years and above, pregnant women and children from 0 to 5 years should be given free medical care. That is what is maintained in this hospital. We have special cards for those free medical treatment, which is yellow in color for the babies and the elderly, and the pregnant women have their own white folder.
So far so good. Since the advent of this administration 4 years ago, 5 now, we've been having constant availability of our drugs in terms of the drug components of the free healthcare. The free healthcare has been working so tremendously in this particular area, covering about almost 6 or 7 local governments and even outside the states. In addition to that, the drugs availability have been made possible by the state governments. Each time we all get to the central medical store, we have always been the central procurement area. We always make sure that the drugs are always available and they always get it down to the facilities. And in addition to that, even the Ministry of Health has made provision for vehicles to transport some of those drugs to our area here. So that has helped us a lot. And the beneficiaries of this free healthcare, as the under 5s, children, the adults, which are over 60 years, and all the pregnant women up to surgery, enjoy this wonderful opportunity which the state government has offered them.
Free health services embarked upon by the Akwa Ibom State government is working at General Hospital Akwa Ibom 100%. In short, when this program got started, this was one of the first hospitals, the pilot hospitals that were being used. And it's working for the under 5, the pregnant women, and the aged over 65 years of age.
They did not charge me money. If they didn't charge me money, I cannot get money to pay. So they take care of me well. They know money. They take good care of my begin. They don't charge me any money.
From pregnancy up till delivery?
Yes, even the time I register here, no, they're not collect any money from me.
The thing I can advise from here is that since I am pregnant, they are not to collect any money from me. They're taking care of me, do everything in the right way. The time I'm sick, they just take care of me. Well, that's what I say. The business I'm doing is very fine.
We are proud of him. As regard to health, he has performed creditably. He has performed so much. In fact, the pass mark we are giving to him is 100%. Nothing short of that.
It is a pleasure. First of all, I should be very thankful to my God, the God Almighty. The performance of free medical in Akwa Ibom is what we have never even expected in Akwa Ibom. Presently, there is free medical mostly for the elderly people like us, like from 50 years above. We take treatment without paying anything. Even we receive card with nothing. Pregnancy women, free medical. Everybody, nearly everybody in Akwa Ibom are receiving free medical treatment.
Experience in Emmanuel Hospital have been wonderful. Been taken care of free of charge during the pregnancy, and when it came time to deliver, I was there to deliver. But I delivered through operation, which was free, and it was wonderful. And I've been taking care of the nurses, I've been taking care of the baby, the doctor have been taking care of me free of charge.
Actually, I've enjoyed everything here. Everything is free. Before they used to charge us a lot of money, but now it's easy for us. We do not collect any money. Start from the starting for registration is free. Except you buy what your baby is going to need. I'm enjoying it.
The renaissance in the health sector has undoubtedly eliminated public apathy towards government-owned health institutions. Available data shows that patronage of hospitals, which had fallen as a result of decayed or deteriorated infrastructure over the years, has begun to pick up. Several thousands of infants, pregnant women and elderly have been treated free of charge, in addition to many surgical operations handled under the Medical Revival Scheme.
What is the output? We saw situations where the inpatients and outpatient ratio were tripled, with the free medical care for the young, the infant, the young, and the elderly. People just came in. The facilities, the equipment, the drugs, everything came in at the same time. They complemented each other. So you saw that it was a plan that was implemented because we were prepared.
Since the government declared that there is free treatment for the pregnant women, so we've been having a lot of patients here. Sometimes we register up to 90-something a week, then sometimes 70-something.
The journey in the health train has been quite interesting and very eventful. This is another sector that has stood Akwa Ibom State out in the Committee of States.